today we're going to look at the plantar fascia. So we spoke last week about the Achilles tendon, and as you remember, the Achilles tendon comes down to the back of this bone, which is the calcaneum, and some of the fiber will continue and will start forming the plantar fascia, which is this soft tissue band that runs at the bottom of the foot. On this model you can see it will start from this big proeminence on the calcaneum and run forward to come and attach onto those bones there, which is the head of the metatarsal bones. The plantar fascia has got many roles. The first one is how it's going to maintain a good foot arch, which is very important for a good foot biomechanic. It works very closely, as we know, with the flexor digitorum brevis, this little muscle there, and they are going to work together to try to bend your toes. As you do that, as we are bringing those bones there close to the heel, we are going to produce some tension, and it's a superior tension there that is going to lift your tarsal bones, those little bones, up. And this is going to be helped on top of that by another tendon called the tibialis posterior. I know you runners will have heard about it. That runs down there and attaches here. I'm going to do a video about the tibialis posterior tendon because it's a great tendon. It's very interesting the way it works. So all those three structures will work all together to try to lift the arch up. The second role, really, is how it's going to help with walking, with your gait. We know that some of the fiber of the Achilles tendon pass under the heel and will attach there to form the plantar fascia. So it means that when you are landing, when you are walking and you are landing on your heel, your foot comes down there and you're starting to put more stress onto your plantar fascia. During that moment of putting your weight on the foot, your foot is going to start spreading, is going to open up, and your plantar fascia is going to try to stop that, to control that. And as it's doing that, it is going to start to keep a lot of energy. A lot of energy is going to be kept in the tendon to try to stop the spreading of the foot. And as you pass your step and you are starting to, so you've got your heel strike, you push, you've got the spread during that moment, and then you start to push off. And during that period of push up, a lot of that energy that has been kept in the tendon is going to be freed and is going to help the Achilles tendon in the propulsion phase, in the push-off to try to help you to step properly. So the plantar fascia inflammation is a problem we see a lot in any kind of running clinic. That pain is very often felt in that area of the foot. Although the plantar fascia is not completely seen as a tendon, it behaves like one. So just like with the Achilles tendon, any change of training, any change of trainers, any change of training potentially could cause problem. The other issue we've got as well is it is, as we know, going to try to maintain a good arch work. So as soon as you start having problem with your arch falling, it will cause problem in a joint called the subtalar joint, and as soon as the subtalar joint does not move properly, it is going to increase the stress on your plantar fascia. Because it works very closely with Achilles tendon, as soon as you start developing Achilles tendon weakness or an injury, your plantar fascia potentially could be affected. Just like the Achilles tendon, as soon as the range of movement of the ankle is affected, the tendons cannot move properly. Tendons don't like that, and once again, they potentially could be inflamed. There are a couple of conditions that we see at the clinic where patients think it's a plantar fasciitis, but it is not. The first most common mistake is in fact an inflammation of the fat pad of the heel. We've got a thick layer of fat here that is there to protect the bone as you are landing on the foot. And if you've got too much repetition on that layer, it could be just by a sudden narrowing of the fat pad by itself, or we see that a lot with people who are overweight. And the amount of pressure, repeated pressure on that fat pad makes it inflamed. The other problem we see very often is an inflammation of the tibialis posterior. I mentioned that tendon before that comes down there and attaches on that bone, and could give you symptoms very similar to plantar fasciitis, but is not. So how to avoid a problem with your plantar fascia? Well, it's very, very similar to the Achilles tendon. You need to make sure you've got good calf strength. You need to make certain that your ankle mobility is good, and you need to work very hard on trying to maintain a good arch of your foot and a general good strength of the foot by working on proprioception exercises, loads of jump on one leg, change of direction, change of sudden movement to try to help your foot to be as strong as possible. But once again, the most important thing is any change of training, any change of routine needs to be progressively. When you get new trainers, you need to try them very slowly. Don't start straight away doing a 10K, 15K with trainers you've never tried before, because your biomechanics potentially could change, and that could cause plantar fascia.